Thanks to the organizing committee for the invitation to this talk. It's a great honor. I'd like to share with you how we established pediatric nephrology care in Guatemala. And this is the history of the Guatemalan Foundation for Children with Kidney Diseases, Fundanier. To give you some background, Guatemala is located in Central America. We are 17 million people. Spanish is spoken mainly, but we have 23 different Mayan languages that are spoken in the country. More than 50% of the population lives below the poverty line. I'd like to illustrate my talk with the history of Annie. It was year 2000, and I had just returned from my ISN-sponsored pediatric nephrology fellowship, and I had to see this 7-year-old girl with advanced kidney failure. Annie was admitted to one of the 2 beds of our pediatric nephrology ward. She needed a biopsy that we couldn't process locally. Therefore, I contacted my friends at the university hospital where I trained and sent the sample, and the result came a few weeks later. But to make a long story short, meanwhile, Annie needed hemodialysis, and we didn't have a pediatric catheter that had to be imported. The pediatric facility was not available, and Annie had to be dialyzed at the adult unit, which was a terrifying experience for her. A few weeks later, the surgeon placed a peritoneal catheter, and he didn't feel comfortable because it was not a common procedure at that time. I myself trained the family with continuous ambulatory peritoneal dialysis, and a few months later, we decided to go for a transplant. Again, tissue typing was not available, and I had to knock the door of my friends at the university hospital. Our public hospital didn't offer the transplant surgery, and the family had to raise money from relatives and friends in order to pay for the transplant in one of our private hospitals. Then came the issue of the anti-rejection medication that the family had to pay out of pocket. Finally, Annie was transplanted, and the family was really grateful. And they decided to change the story of all the Guatemalan kids with kidney failure. And with other parents of patients, launched in May 2003, the Guatemalan Foundation for Children with Kidney Diseases. So if Annie were to be treated today, her history would have been completely different. If a patient with advanced kidney failure comes to one of the tertiary level hospitals in Guatemala, the patient is referred to this 2-story facility devoted to children with kidney diseases. Then the family will encounter with a social worker who would help them navigate through our health system. Then a multidisciplinary team will take care of the patient, pediatric nephrology or pediatric nephrology fellow, psychology, renal dietitian, and a pharmacist. And if the patient has to be admitted, the patient would be admitted at the 14-bed inpatient service. And if a biopsy is needed, the tissue would be processed next door at the nephropathology facility at the University of San Carlos. If PD is chosen as a therapy, one member of our technicians would help the family and train the family to do the procedure. If hemodialysis is chosen as a modality of therapy, our pediatric facility is offering the treatment as well. Our surgeons schedule 1 pediatric transplant each month, and the families receive the anti-rejection medication free of charge, as well as the other services that I mentioned. Fundanier has been recognized by the International Society of Nephrology as a regional training center. So what I would like to do in the next minutes is to share with you what I think have been the key elements that have helped us in the journey from point A to point B. So let's get started. First of all, I cannot stress enough the importance of having a kidney foundation. It has helped us with fundraising and with the management of donations, but also has given us a better position to negotiate with our partners, including the Ministry of Health. But remember that having a kidney foundation makes you accountable. You have to manage the name of the Kidney Foundation and your name as a trademark. So you have to be very careful where you partner with. And I also wrote there that you have a lot of responsibility taking care of children with kidney diseases. So you don't want to take the responsibility of others. And I illustrate this with the agreement between Fundanier and the Ministry of Health. In this agreement, Fundanier took the responsibility of building the facility, of training the personnel, and also of getting the medical equipment and the hemodialysis machines and furniture. On the other hand, the Ministry of Health committed themselves to purchase all the medications, all the disposables that were needed to treat the patients, and also to hire the personnel. But if you are like myself, I was trained as a clinician. I didn't have a clue of how to develop a kidney foundation. This source comes very handy if you want to set up a kidney foundation. It's the International Federation of Kidney Foundations World Kidney Alliance. They have more than 65 kidney foundations from close to 40 countries. They have an annual meeting. If you come to this meeting, you will encounter representatives from different kidney foundations in different stages of development. So you are going to learn from others. They even have a program that helps develop kidney foundations in small countries. Next, you need a network. It will give you some perspective and also credibility to belong to some organizations as well. And if you participate actively in these organizations, you can amplify your effort. But remember that you have to manage your name as a trademark. So you need to be aware who are you going to partner with. Remember also that relationship takes time, your time, so you have to be very strategic in where you want to place your effort. And also, building trust takes time. If one of these organizations helps you with something, make sure that you send them a report, even if they don't ask you to do so. I mentioned some of the organizations here: ISN, IPNA, TTS, Bridge of Life. And if you are in Latin America, the Latin American Society of Nephrology and the Latin American Society of Pediatric Nephrology are very useful. I also like to have close contact with Rotary International and Order of Malta because they can help us with the delivery of medical supplies among countries. Next, you need to build a team. Not just because this team is going to take some burden from your shoulders and will amplify your effort, but also because your patients are better treated by a multidisciplinary team. But remember that coaching takes time. So you need to invest yourself in making good selection of people. And even if you think that you have done a good selection, some of these people are going to be trained and then they will leave. That's okay. Don't get bitter about that. Train someone else. If I had to start my team from scratches again, I would again start with the dialysis technician. This person is going to help you with the care of patients, with the education of patients, and also with the tracking of data. Bridge of Life has a very nice program with that. Since Bridge of Life is the social arm of DaVita, they have a group of dialysis technicians that volunteer to go in medical missions to other countries. My next member would be a pediatric renal dietitian. They can help you with the training of people, with the education of people. Bridge of Life has as well a good number of renal dietitians that volunteer to go in educational missions to other countries. And IFKF has a very strong presence of renal dietitians among the organizations. They have a lot of educational materials, recipes, and so forth. Since we are pediatric nephrologists, more likely than not, we are going to deal with urinary tract malformations. So make sure that you have a committed surgeon by your side. We have accomplished that with the pediatric urology service of the University of Indiana. You know, they come every year for 1 week and they operate with our surgeons 50 to 60 patients. They have trained our surgeons to do the surgeries. Basically now our surgeons do the surgeries by themselves, but they continue coming because it's a nice experience for their surgical residents and fellows to have this relationship with the people from the University of Indiana. At the beginning, Healing the Children started the contact, and now Rotary International is sponsoring the activity. If you plan to have long-term hemodialysis, you may need a surgeon trained in vascular surgery. We have the same surgeon doing the urological procedures as well as the vascular surgeries. Bridge of Life has helped us with that. For the last 8 years or so, they have come for a week every year, and they do procedures with our surgeons. Right now, again, our surgeons do basically the whole procedure, but it's also a nice teaching experience to have them here. When it comes to pathology, ISN can help you with the fellowship training program and the sister center program. And training a pediatric nephrologist, you have a menu of good options here, but remember to use regional training centers. They can provide training that can suit your needs. When time comes, you will need a transplant program. TTS can help you with that, with the fellowship program and the sister center program. Next, I think it's important to keep record of data. Even if you think that what you are doing is not important because you are working in a tiny village, in a tiny country, your data is going to tell your story, and your story is going to help others. And it also will provide some arguments for negotiation with your partners and will give you credibility. It will take time, and having publications is becoming more and more expensive, but even if you publish it locally, it will do the job. And last but not least, you have to plant a seed. Your dream of treating children with kidney diseases cannot retire with you. But coaching takes time, and loyalty is not a universal trait. So you need to think ahead of time who you are going to train to take over your place. This is a picture taken in 2008 with the Dean of the Medical School of the Guatemalan University and my former mentor, Dr. Richard Ziegler. At that meeting, we established the pediatric nephrology training program at the University of San Carlos. From then to now, we have trained 15 pediatric nephrologists. We are 17 million people in Guatemala, but we still have some way to go, but we have covered the largest cities in the country. This picture shows 2 generations of pediatric nephrologists that are going to take over the program of pediatric nephrology. What happened with Annie? So Annie is enjoying her transplant. She became a food engineer, and she sent me last week this picture from England where she is doing her PhD in London. So thank you very much for your attention.